It's my pleasure to introduce Prajakta, who brings the perspective of being a young woman who's gone through thyroid cancer. And so she's going to share her experiences with us today. And then after this, we'll have our final panel. So thank you so much for joining us today.
Hello, everyone. Thanks, Heather, and thanks, Stanford, for giving this opportunity to me. And thanks, Dr. Blumen and Khan also. It's a good continuation based on the thyroid. I'm actually a papillary thyroid carcinoma survivor. It's been 2 years now. And it's a very strange and unique story for me. It started with the same thing, like I was sitting in a conference just like this, but it was a professional conference. And I just touched my throat over here, and next 2-3 days it was paining. And out of curiosity, I'm pretty proactive when it comes to some health matters. And I went to Stanford Express Care. That's a very good facility to have same-day appointments. And there I came to know that there are a couple of nodules that the doctors diagnosed, and they said that immediately it would be better to get the images done and also, the ultrasound done. And I was traveling next day to Tennessee for my vacations, and I said that if it can be done, earlier, it would be great. And same day I was able to get the appointments. I got my ultrasounds done, and unfortunately the size was out of the normal range. And they said that you need to undergo the biopsy. And I am an impatient person. I concluded that, okay, I am a victim of that C word. That's all. Before even concluding on the biopsy, I decided, okay, fine, that something bad is going to happen. And I was not getting the biopsy appointments. It was like almost at the end of that month, but somehow I was able to get into the walk-in, and the biopsy was done, and the results came out on the day of my anniversary that you are affected by the papillary thyroid carcinoma. That was a less shock for me because I already concluded that, okay, I had something like this. But I'm a mom of 2 daughters, 2 sweet daughters, just 4 and 7 at that time. And it was really very bad that what is going to happen. And when anyone hears this word C, it's like, fine, that's the end of life. No, it's nothing like that, because there are doctors, there are strategies, there are new techniques which can lead you to a better life. So just don't conclude on anything right away. So I was able to get the appointments over here in Stanford immediately with Dr. Sunwoo, who is heading the head and neck oncology. And also he's a super specialty in parathyroid and thyroid glands, especially in case of those oncology-related subjects. And, once you meet a doctor, I guess if he's the best doctor, your disease is cured right at that moment, at least 50%. That's what I felt after meeting Dr. Sunwoo. He was really very nice in counseling and also making a patient comfortable, letting him or her know that what actually this disease is about. What are going to be the treatments? What are going to be the consequences? And all the steps going forward. What is going to be the line of treatment and the follow-up treatment? So I was pretty comfortable at that time. But I didn't get my surgery date meanwhile. And I was under the impression that, okay, this is going to spread so lot. And almost I told my parents back in India that please arrange surgery date for me. I'm flying next day and I'm coming back after 15 days. Then everything was done. I went to my PCP and she was looking at me, are you insane? People from the corner of the world come to take a treatment here in the US. You are attached to Stanford. Why do you in the world think that you want to go to India and get the treatment and surgery done? I was like, I'm not getting the surgery date, and it's still like 1 or 2 more months that I would get a date later on. My anxiety levels are too high. I cannot sustain this. She said, what about the follow-up treatments? Are you going to go to India for all the follow-up treatments if needed? Somehow my husband was of the same opinion. It's your decision, but I'm of the opinion that people come over here for the treatment, and why then are you going back over there? So at the end of the day, we decided, okay, fine, the surgery is going to take place over here. The surgery went well. I was required to take out my 2 nodules, and I had extra nodular exposure. So I had to undergo the RAI treatment also. And it was right before the pandemic that the RAI treatment took over, I had to undergo isolation. People might think, oh, she might be affected by the COVID, but it was not like that. But for the 4 days, I had to be under the isolation. And my kids were like, what happened to mom? Because they were not aware. But in all those things, really, my family supported a lot. My in laws were over here. So I didn't need to worry about my kids. My husband was there during the surgery, and my mom flew from India. So, really, that family support matters a lot. And one funny thing I wanted to let you know that during this time, my mom was not knowing when my biopsy was under process. And she was talking to me that one of their friends is a very good doctor, is a cancer surgeon, very well known, and many people go over there. But I was not able to tell her that your own daughter is already, a victim of this particular thing. But she also took it later on in a very good spirit, and I was able to come out of this. The ARIA treatment also went on very well. During this time, Stanford was always on their toes to give the schedules, then keep up to date, because ARIA treatment requires 14 days of a special iodine diet, low iodine diet. So they were always there for a helpline and also, guide. As Dr. Blumen said about the Thai CA, that's a very good site which guides you on all type of, what kind of diet you should be taking. Everything was pretty easily available. People are there on the phone line to guide you and counsel. And I was also going through the same thing what everyone goes through, but today I'm totally out of it. And I'm able to give mentoring to others. I was really happy that before my RAI treatment, I was able to mentor one of my friends who was just 4 months pregnant, and she got detected with this. And right on the day pandemic, when the this shutdown started here in the US, she had to undergo surgery. And everything went well. She didn't need any treatment, but I was able to help out her. I was able to counsel her, do the mentoring. And same way, at the other hand, few other people reached out to me that, yeah, we heard that you came out through this. And I was able to meet their requirements. I was able to hear them. So I would really love to mentor other people, also share my experiences. And it's like your mental pressure that leads to some negativity in you, but you should be always positive. I got the positivity results. Today I'm here in front of you. It's all the positivity result, positive thinking, because I was never, thinking this way, that really that positivity and training your mind or your brain will really help out, but it really does. And I experienced both the sides. I was already totally negative, positive way that, yeah, I'm going to get a cancer. And I got it. And today, I have to be a survivor and I have to be out of it. That's another positive side that I already thought, and I came out of it. So it's all about, how you think, how you believe in your doctors, your treatments, and how you take it yourself. So today the science is so advanced, and all the treatments are available, and people are there around you, your family, everything is there. So just be strong, mentally strong, and also follow your doctors, their advices. And anything that you feel weird, like your body might be giving some of the signs, just pay attention to that. And I think good yoga exercises, breathing techniques, that really help. And meditation is one of the best ways to take out that negativity out of your mind. And it's always a fear, right? When you are affected with that C, when you go into the people and they are saying, oh, you are survivor, what happened? And you are not confident enough to tell about your story. But I'm now at this stage that I can carry that scar with a pride that I am a survivor, yes. I'm confident enough to tell this in front of people. And I'm here to talk this thing and share my story with you. So that's all about me. And really thanks once again for giving this opportunity. Thank you.